Knock, 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 coming in. Wash my hands with some hands. Oh, not wash my hands. Gel in. My name is Nurse Milana. I'll be doing your skin assessment today. Can I have you state your name and your birth date? My name is Mr. Sloth Smith, and my birthday is January 27th, 1999. All right. Do you have any allergies to anything? Not that I know of. For this assessment, I will be having a pen light. All right, and my patient is oriented ×4. According to my general survey, I could say that he is well kept, he is comfortable, very well groomed. Yes, and his hygiene is very well. I've also assessed his vital signs, which come in stable for his age and size. All right, from my first look at him, I do see that his arms are long, but they are symmetrical, which is good. Same thing with his little stubby feet. They are symmetrical. His face seems very symmetrical as well. Very cute. And let's check his upper portion. We're gonna lower your gown. All right. So, check for temperature on both sides of his arms. Checking for finger blanching, less than 2 seconds, which is good. All right, Mr. Smith, I did notice you have a little cut next to your wrist. May I ask where that's from? Oh, my dog bit me, but I went to the doctor and they said there's no infection and everything is fine. Good. And I also noticed your eyes are a little bit darkened. May I ask why? Well, my baby's been keeping me up for the past 2 days, so I haven't been getting enough sleep. Pretty explainable. All right, now we're gonna put you back up, and then we're gonna raise your lower portion of your gown. Now, let's see, temperature. As well as texture and moisture. He seems pretty dry, which means very good. No tenderness as well. We're gonna check his toes for blanching. Less than 2 seconds, that's good. The bottom of his feet, pretty good. All right, we're gonna cover you back up. We're gonna turn you over. First, I'm gonna check his hair with my lovely tool. All right, now hair color does seem uniform. Pretty fine texture, but that's okay. It's pretty expected for his hair. He is getting old. All right, no parasites, but I did notice some stitches on your head. May I ask where those are from? When I was younger, I fell off a tree and I got stitches. All right, let's measure it. About 1 inch. All right. There is some slight raising from the scarring, but the color does seem pretty uniform to your skin now, as well as the texture is pretty smooth and there's no tenderness. Pretty good. All right. Now, we're gonna check your back, checking for temperature, any sort of tenderness or lesions, and everything seems pretty good. We're gonna see if your elbows are blanching. Pretty good. All right, now the bottom portion. We can see that his hips here are blanching normally, and they don't have any redness. That's good. Same thing with his hips. So I can assume that he is pretty active. That's pretty good. Checking the back of his legs. There's no edema that I see. Yep, no edema. Checking the back of his feet. Pretty good. No clubbing in his toes as well. Just pretty good. All right, Mr. Smith, we are done with your assessment. We're gonna cover him back up. We're gonna lay him down. Gonna lower his bed, put the side rails up, as well as putting the call light right next to him. Bye, Mr. Smith.